In this lecture, we're going to talk about periosteal reaction, how that helps us to think about some of the things that are causing the periosteal reaction and whether these are very aggressive lesions or very benign lesions. Um, and it's part of describing bone tumors as in talking about if they're eliciting any periosteal reaction. So there are two main types of periosteal reaction, and we'll talk about some of these in a little more detail. But really the main point is the periosteal reaction aggressive or is it non-aggressive? Does it look scary? Does it not look scary? Things that look scary are going to make us worry, and based on how the rest of the tumor looks, we're going to start thinking of malignant processes. Or if it looks more benign or non-aggressive periosteal reaction, we're not going to worry about it as much, and we may consider more benign processes in our differential diagnosis. So that's really the main point. The only real point of periosteal reaction, when we look at it, is it helps us to think about what process is causing the periosteal reaction. Is this process a benign process or a more malignant process or an aggressive process or a non-aggressive process? So types of non-aggressive periosteal reaction are going to be classified really as solid, expansile, or septated. These are the kind of things we're going to see. This is an example of a solid periosteal reaction. We can see here in this coronal CT reformat this kind of heaped up, solid looking, very smooth new bone along the periosteum, and it's surrounding this lytic lesion, which is based in the cortex right here. This was an osteoid osteoma, and this surrounding non-aggressive solid periosteal reaction around it. So basically the bone is responding to in this case, the osteoid osteoma in it, and has time to lay down new bone around it, and this solid bone is what we get. And so this is a typical non-aggressive pattern, a solid periosteal reaction. This is an example of really an expansile lesion. This was an aneurysmal bone cyst. And periosteal reaction can be expansile. In this case, it's very hard to actually see the cortex of the bone. It's just so expanded out. So this is another type of expanded lesion and expansile periosteal reaction around it. Septated, this is a similar appearing lesion. This one happens to be a giant cell tumor. We'll go back and look. This is an aneurysmal bone cyst. I think it's very difficult to prospectively say which is which. Those are going to be the two main differential diagnoses here. But this one has septations in it, and so this kind of septated periosteal reaction, again, you're not even quite sure where this was the cortex that is expanded out here, and this one the periosteum involved within it. So this is another type of a benign or non-aggressive periosteal reaction you can see. Lots of different ways for classifying aggressive periosteal reaction. Again, not really so important that you get hung up on, oh, where is this sunburst or is this hair on end? But the takeaway point is that, hey, this looks scary. This is an aggressive periosteal reaction. I'm going to think about scary things that are going on in the underlying bone, and we're going to be worried about this. So sunburst periosteal reaction is one of them, and this is an example of a sunburst periosteal reaction. We see these kind of spiculas of bone, periosteum, which are radiating outward from the bone, kind of like a rays of a sun. And really this is the tumor underneath is growing quickly, and the bone doesn't have a lot of time to lay down proper new periosteum, so you're just getting these disorganized spiculas of bone which are radiating outwards. And so this is a nice example of a sunburst periosteal reaction, really something scary. We don't really see a tumor here very well. You get the vague idea there's some sclerosis here. This was a periosteal osteosarcoma in this case that was causing it, this periosteal reaction. Laminated periosteal reaction is just bone, layers of bone, kind of like an onion skin. So the periosteum is laid down one layer and hasn't quite had a chance to finish, and then another layer is laid down, and these kind of alternating layers of bone, one on top of each other, with these lucencies between them, like an onion skin or something laminated, multiple layers stuck on top of each other. So you'll see these in as an aggressive type of periosteal reaction. Here we see both sides of the humerus here. This laminated periosteal reaction is kind of heaped up bone, and there's this gap here, and then more periosteum is laid down on it. And so we're going to think about scary things in this case. This was lymphoma, which was causing this periosteal reaction. Hair on end. I think hair on end and sunburst periosteal reaction, they really kind of look alike. Hair on end, most people describe as it's just sticking straight up and not really kind of curving or radiating as much. I think that's a fine point. It doesn't really matter too much. Again, both are aggressive periosteal reactions, so don't waste too much time perseverating about is this sunburst or is this hair on end. Both really mean the same thing. Something aggressive, something fast growing is there. So hair on end is really just because the bone just kind of sticking straight up, just like you'd be electrocuting your hair, sticking straight up. Codman's triangle is some of the periosteal fibers that are lifted up and kind of displaced. So you get this displacement of the bone. You see there's periosteum right here is kind of forming like this triangle with the underlying cortex. And another example on the other side. Obviously, this is a complicated periosteal reaction. In this case, there's not only a Codman's triangle here and a Codman's triangle here, but you also get this sunburst periosteal reaction right here, and maybe some hair on end right here. Very complicated periosteal reaction. There's this soft tissue component of the mass and this geographic sclerotic lesion with a wide zone of transition in the distal femur. This looks scary. This was an osteosarcoma in this patient. So example of multiple different types of periosteal reactions. In this case, Codman's triangle is the one that I think they always teach you in medical school, traditionally associated with osteosarcoma, but it doesn't have to be. Any aggressive process can give you that. We're just going to look at some different examples now and just to get a sense of all the different types of periosteal reactions that are out there. This is a case axial CT scan through an osteosarcoma showing us a Codman's triangle periosteal reaction right here. Here's the periosteum lifted up off the bone. It's kind of filling in with some sclerosis here, and you get a sense there's probably some hair on end periosteal reaction here. Again, not so important that you describe it perfectly as the type of periosteal reaction as long as you recognize that this is an aggressive periosteal reaction. So you can think of aggressive tumors or aggressive lesions causing this. In this case, again, osteosarcoma. There's another case, a radiograph of the lower extremity. This looks kind of really bizarre. I'm not sure this periosteal reaction fits into any of the neatly classifiable ones. Clearly there's some periosteal reaction here. It's wispy and quite prolific along the both the tibia and the fibula, and there's some solid thickening here, and there's this kind of wispy periosteal bone around it. Very bizarre looking. This is just a strange case of periosteal reaction from venous stasis. Not the most common appearance of a periosteal reaction in venous stasis, but long-standing venous stasis is a common cause of periosteal reaction. You see that in the lower extremities a lot. Here's a more typical case of periosteal reaction from venous stasis disease. And this is a more solid periosteal reaction along the fibular shaft and to a lesser degree along the tibia, both due to venous stasis. This one looks a little more bizarre. This one is more typical of benign or solid appearing periosteal reaction in venous stasis. Can I tell you for sure that this is venous stasis? No, there is a differential for this, but this is one of the more common ones that causes this. So this is venous stasis. All right, Conan radiograph here of the distal radius and ulna. Here we see this laminated periosteal reaction along the radius and to a lesser degree along the ulna right here. Very focal, heaped up right here, these kind of alternating layers of sclerosis and lucency and sclerosis. This was periosteal reaction, which in this case was due to HPOA, hypertrophic pulmonary osteoarthropathy, usually due to some underlying thoracic process. Often could be a lung cancer, though it doesn't have to be any kind of thoracic process can cause this sometimes. So this was a periosteal reaction from HPOA. Next case, another radiograph of the lower extremity. Solid periosteal reaction heaped up in the middle of the fibula right here. Very focal right here. This was from chronic osteomyelitis in comparison to the venous stasis one we saw earlier, which really went throughout the whole of the bone. This is very focal right through the fibula. So chronic osteo, could this be from trauma? Sure, it could be from trauma as well. In this case, this was from infection, but this is a more less aggressive or non-aggressive appearing periosteal reaction, chronic infection in this case. All right, this is another one. This is an axial CT. We see this very solid heaped up periosteal reaction surrounding this central lytic lucency right here. If you look closely, there's a focus of sclerosis in the midst of this lucent lesion, this kind of central nidus. This is really good for an osteoid osteoma, causing this periosteal reaction around it. Very smooth, very benign appearing. This is the same one we saw earlier on the coronal reformat. This is just cutting axially through it, showing a very nice example of kind of solid periosteal reaction, in this case in response to the underlying osteoid osteoma sitting here. I think a Brody's abscess is a reasonable differential to consider in this case. We saw this one earlier. This was the osteosarcoma, again, just showing us the Codman's triangle and the sunburst in the areas of hair and end periosteal reaction, and the sclerotic lesion in the distal femur. Very aggressive looking osteosarcoma. You're not going to mistake this for a non-aggressive or benign periosteal reaction. This one doesn't really have a lot of periosteal reaction. You see there's some bone which is lifted up from the cortex right here and kind of extending out. You get the sense there's this giant soft tissue mass associated with it right here. So this one doesn't really fit nicely into our descriptors, but perhaps it looks a little scary just because of this giant soft tissue mass right here. In this case, this was a recurrent osteosarcoma that wasn't treated fully and then had returned, and so this periosteal reaction, almost Codman triangle-like, with associated soft tissue mass in this region. So this was a recurrent osteosarcoma. It doesn't look like a typical osteosarcoma in this case, probably because it was incompletely treated. All right, this is a child in this case. We see there's this geographic lytic lesion with a wide zone of transition right here, and around the lesion we see this solid heaped up periosteal reaction. The periosteal reaction is fairly non-aggressive appearing, even though the lesion itself, because of the wide zone of transition, looks a little scarier. So I think it's reasonable to consider more infiltrating processes such as a lymphoma or an Ewing sarcoma or infection. This case turned out to be a Langerhans cell histiocytosis, or EG, in the bone, but a less aggressive, solid periosteal reaction appearance. All right, this one clearly looks scary. CT scan shows this hair on end periosteal reaction along the iliac bone, and there's this diffusely infiltrating sclerotic lesion throughout the sacrum and the left iliac wing, and partly into the right iliac wing, and there's a soft tissue component associated with this. So again, an example of a very aggressive appearing periosteal reaction. When you think of differentials, this could be, I don't think any benign things are really going to be on your list. So this was in this case, it was a malignant degeneration from a Patch's disease. Another example of an osteosarcoma, just showing you the nice kind of hair on end or sunburst periosteal reaction coming off the distal femur here. Obviously, they're a child. You see this in a kid. Again, osteosarcoma is one of the things you should think about. Scary looking periosteal reaction here, so very aggressive looking. All right, two radiographs of the elbow. We see this laminated periosteal reaction. We saw this one earlier when we were talking about laminated periosteal reaction. This is just the other view. So this was a lymphoma, in this case infiltrating the bone, causing this aggressive laminated periosteal reaction in this case. Last case, radiograph of the foot, which shows this solid periosteal reaction about the second metatarsal, and you get a sense there's actually this linear lucency through here. This was periosteal reaction in response to a stress fracture. Over time, it's built up this periosteal new bone around it. So a very benign or non-aggressive periosteal reaction in this case. And since we can actually see the lucency through the metatarsal here, saying stress fracture in this case is a very good bet for what this is. So